ఏవీస్ వాస్కులర్ సెంటర్ మన దేశంలోనే ద బెస్ట్ వెరికోస్ వెన్ హాస్పిటల్.
Hi viewers, welcome to iDream. I am your host. Aparna. Cancer is a topic that has been heard a lot lately. Why does this cancer actually occur and what are the treatments after it occurs? And now we are with the latest Omega Hospital's MD and the best oncologist, Dr. Mohana Vamsy Garu. Let's talk to him. Namaste Vamsy Garu.
Namaste Andy.
But coming to this AI technologies, we will get into the treatment advancements with a couple of questions about the advancements in our cancer. Those who see cancer have a thought that crores have to be spent. So will the financial burdens increase or decrease due to the technologies that have come now?
Madam, one thing is very clear: modern medicine is prohibitively expensive. You can't believe me? Can you imagine how expensive the artificial intelligence-powered digital pet mister that I am going to tell you now is? No.
It cost about 40 crores Indian rupees.
Just for that machine. Oh my god, do.
You know how much that digital pet city is?
15 to 18 crores Indian rupees. This is not a one-time investment. Annual maintenance contract will be 1.5 to 3 crores.
Okay.
Annual maintenance contract.
Just maintenance, 3 crores.
Machine cost per year: 40 crores, 20 crores, $4.5 million. And do you know what else is unfair? If you buy this $4.5 million, you have to pay 30.5% tax. You have to pay 30.5% tax on life-saving equipment to the government. Last year, it was 27, and before that, it was increased by 4%. When asked why they increased it, they said that if Ayushman Bharat is funded by taxes like this, it will get 4,000 crores.
And they will utilize that 4,000 crores for Ayushman Bharat. I ask the question. The finance minister came to Hyderabad after the budget. I was also fortunately one of the people they invited. I asked this question. Last year's Ayushman Bharat budget was 8,000 crores, out of which 4,000 crores were unused.
What are you going to do with 4,000 crores? You have put such a burden on us.
No, this is only to support Make in India. This thing Make in India quota subsidies should be given if imported, but these machines are not made in India. All have to be imported.
30.5% tax should be paid, i.e. if you buy 10 crores equipment you have to pay 3.5 to 3 crores tax. After that the annual maintenance contract starts, which will be 3 to 4 crores. Very expensive cyber knife. I will tell you next time that itself cost us 25 crores in treatment these days 10 years back. Annual maintenance contracts 2.4 crores. This machine called Ethos, I think. Let me explain to you next. In this treatment, you are asking for advances. That machine costed $4 million.
So,
we have to get a bank loan for all of this, 40 crores, 50 crores, and we have to pay interest on it. Then we have to sign a maintenance contract. Again, the hospital is a commercial institution and you have to pay electricity at commercial tariff. You have to pay everything at
commercial tariff. Okay, where is water at commercial tariff? That
means it is
prohibitively expensive, and all its medicines are also prohibitively expensive. Why is India a signatory to the General Agreement on Trade and Tariffs? In 1994, India signed the treaty that is to protect intellectual property rights. That means they worked hard and spent billions of dollars to make that medicine. If we copy it and do it correctly, then what is the impetus for research? India signed that treaty
back in 1994, so all the medicines are imported, so they're prohibitively expensive. All these mobs and MIPs are prohibitive, expensive, beyond the reach of a rich man, not a common man. So it is a misconception among the people that they do costly tests. They only catch it if they test it. If they don't test it, how do they catch it? How do they know what stage it is in? And many times, in cancer treatment is as important as follow-up. In follow-up, we need to know if the disease has returned. What can't be done with the hand? What can be seen with the eye? We need to scan it, only. If there is an extensive follow-up, how expensive are patients?
Many people.
Don't get tested there. Suppose a poor patient doesn't get tested. Suppose a thin headache comes. The doctor said, a breast cancer patient has a headache. Many poor patients don't even wear clothes properly. The attendants don't even wear clothes properly. Okay, let's observe. Quote, I wrote medicines and sent them. She came to me again after 15 days with a headache. She came for the second time with a headache. The poor patient must be really suffering from such a distance. I did an MRA scan. There were metastases.
Alas.
That's all. 10 attendants came the next day. I told her I had a headache 15 days ago, but you ignored me. They say that if they had done the scan that day, our condition would have been better. What's wrong? If you catch it 15 days ago, the prognosis is not good. If the breast cancer has spread to the brain, then they should understand that. 15 days ago, we told you that you have a headache. I told you twice. You didn't care about how long you were seeing the number of patients. You were concentrating on one patient. You scolded me and left. Oh, your intention is different. That's right. So it's scary. It happened to us the day before yesterday. I had a close call. A patient with stomach cancer reached the 3rd stage. I asked him why he came so late. He was very young. He was very young. He was very angry. Why did I come so late? I have been going as a gastroenterologist for about 2 months. He fired me and said, sit down, Nana. I sat down and saw who would do the gastro trial.
Seeing that he is my close friend, he also called him and said, what is the matter, brother? With that call in the evening, the patient is scolding you. It doesn't matter if he is scolding you.
That's what I said when I went to the op clinic. There would be 20 people sitting in my clinic. Everyone has the same complaint, gas sir, gas sir. If I put a gastroscope on everyone who comes, they would go out and say, this doctor is a commercial, 3,000 rupees. If there is gas in every stomach, can he give me gas medicines? They would scold me for being commercial, saying, I paid 3,000 rupees for an endoscope, so I will not give medicines. If it comes for the second time without any decrease, then I will change the medicines again and give another course. If it
comes for the 3rd time after 15 days, then I will give it to the scope.
But by then it is too late. It
may be too late. It
is over. It
is over. So, what is the reason? What is this? The trust between patients and doctors has been lost for all patients. When a doctor tests, a doctor commercial is made, in which he gets this percentage from that diagnostic center. Patients are also thinking like this, I have
seen many times, I have seen many episodes. I went to me like this once for a CM. The doctor came to me wearing a white and white shirt, in front of the CME. In a village, then some of my colleagues were there, friends, school friends.
He asked me, why did that doctor come to you? He is a big doctor in our village, a doctor with good ethics. He doesn't do any tests for anyone. He doesn't just write tests. He looks after everyone very well. He treats everyone at a low cost. What do you mean when a doctor like that comes to you? He means I'm not his classmate. I'm a specialist. He came to listen to my lecture. They said that doctor, that senior doctor, came to listen to my lecture and came to know what is new in oncology. They are general physicians. They came to know these things. I said that in the same year, I saw 2 cases that doctor missed from that village. I said,
okay.
That doctor just examined and sent it back saying there was nothing in the breast. There was a lump in the breast and he didn't do a mammogram. What does he
mean? The patient is poor and needs to be treated at a low cost. Obviously, this is not like cancer. Just writing a mammogram for this is 1,500.
He feels that way.
Correct.
So 2 patients came to me in late stage. So it has become very difficult medical practice. You are sitting happily like this and asking questions. The reason is that if you write a test, it is a pain. If you don't write a test, it is a pain. If you tell about the patient, it is a pain. If you don't tell, it is a pain. If you don't tell, it is such a costly test, doctor.
Yes, that is Dr. Mohan Garu. I mean, I don't want to sound rude. Something what you said is correct. Some now, when a disease like cancer comes, as you said, it is very costly. Only if we use technology, we can easily find it out. So some diseases cost money, but now in a way, even small diseases are more doubtful. Small diseases don't mean anything, madam. If you get pharyngitis, should you get corona test done?
Patient gets.
Fever post-op. Patient gets fever. Fever is wrong blood culture urine. The patient is screaming. Suppose the culture has not subsided. Suppose we have given the usual treatment. Suppose it is a normal fever and it has not subsided after 3 or 4 days. Quote, it has been 4 days and it has not subsided. Another attendant comes, then the educated attendant asks, why didn't you send the blood culture yesterday? It's very difficult to
Practice. Madam, when will we leave this practice? I have studied so hard and done MBBS, MS, MSc, FRCS and gained so much experience. When will we leave this practice? It has become very difficult for the patients. That practice is beyond our
scope.
People have lost trust in the doctor. This doctor is working for me, so despite all the hard work, the patients don't believe that this doctor is working for me. So even if you are a very experienced doctor, you have been here for so many decades.
So if the government and hospitals and other organizations work together, is there any chance of finding a solution?
Madam, there is a hospital, our maternity hospital. What is it called? There is a hospital in the old city. Look at
that. They do 20 deliveries a day, 20 caesareans at night. Is it humanly possible?
No, they
Do 15 deliveries. Our government doctors sit in the OP and see 40 to 50 people. They miss. It's not possible. And in the court, they postpone a case as many times as they want. Honorable judges. Doctors do not postpone. They have to make a split-second decision every now and then, whether to do surgery or go home at 12 o'clock in the night, and then they may have already done 10 cases in their sleep. Yes, it is a very difficult decision, but every time the doctor is blamed. In the same case, Salman Khan is found guilty in the High Court, but not guilty in the Supreme Court. After hearing arguments for months, we have to give a decision in a minute. Whether it is appendicitis or perforation, it is very difficult. It is not humanly possible for people to change. This should come. Change should come. Yes, all doctors, you are someone. 1% of the doctors may be a little commercial. Not all. Not all. Not all. Not all. Now, when we see a patient report, if he has cancer, the patient will come back. When he comes for follow-up, it should not be cancer. Before seeing the report, I have the same tension as the patient. I did the surgery, I gave him radiation chemotherapy, he should not come back. He should not come back. They take those reports and follow up with a lot of tension. I also have the same tension when I open them. When I say, negative for metastasis, I feel more relieved than them. Okay, we are all
human beings after all.
Especially cancer patients identify with us.
Yes, the
Rest of the appendicitis surgery is once done, you never see the surgeon again. They don't
do that to us. They do surgery, then chemo, then radiation, then regular checkups. When I see the ones I did 20 years ago, I first go and hug that patient.
I operated on him 20 years back. You are alive. I spend the whole day excited. Okay, that was a big success. I operated on him 20 years ago. I was in Apollo in 1994. The patient who was operated on came to me for a checkup the other day. Okay, I was really in a very happy mood that whole day.
so it's kind of a refreshment. I was
Very happy. I operated on him that day for cancer. If you come to me after 28 years and follow up and make sure that there is no cancer again and go away happily, it's a great achievement for me.
so sweet. Actually, it means that you remember her.
They remember us, we remember them.
They remember us.
So trust is a little more. Bridges need to be built. We need to understand that the
Doctor is not a god.
We do tests and decide. The human body is very complex. Why did it come and give me this cancer? The doctor tells me this cancer. I have never smoked a single cigarette or a beedi. I am not in pollution. I have been farming in the village. I have not used fertilizers or pesticides on my crops. I have eaten organic foods. I have sucked and drunk our grasshopper milk. Why did I get it? He says, it's the
Human body is very complex. No.
one can tell how it reacts. No one can tell why it comes. We
Give the same treatment to some people for a cancer. Some people it comes back. Some people it doesn't. Can't predict anything, so that's why a senior surgeon told me when I joined. The unpredictable.
okay.
Biological behavior of the tumor makes the most predictable treatment unpredictable.
Right, so true.
So true, and who else? People don't do that. They have done everything, and why did it come back again, they ask. Yes, new ones come. For example, suppose they have cancer in the right buccal mucosa, i.e. on the jaw. They have a very high chance of getting it on the left side duct on the ring. So it is cured, so they did surgery on it and gave radiation, and why did it come back here? Then what do I say? I ask them which city. Suppose he said Godavari. If coal is found in Godavari, I will say that coal will also be found in the neighboring Bhupalpally, Mandamari, Pettapalli, and Mancheria. Suppose he said Bhimavaram. If petrol is found in Bhimavaram, I will say that petrol and natural gas will also be found in Palakalu, Narsapur, and those Rajol. Not too, many people do not even know the names of the towns. Everyone knows Dubai for our people. If petrol is found in Dubai, I will say that petrol will also be found in Muscat, Abu Dhabi, Bahrain, Kuwait, Basra, and Tehran. So it's field cancerization. We face many problems like that. Cancer treatment is very difficult. They will come back. They should be able to face the return. It is very difficult, but most important of all, you said that financial problems earlier.
Yes.
There is no money. If such a disease comes, what they have earned for 20 years will be gone.
That too will be gone in 2 months.
That will be gone. I see a patient who comes in a deluxe room. After that year, he will be admitted in a general ward.
What is the solution?
Solution: we should discover medicines in India.
Why is there no impetus for comparative to states research in India that is beyond our reach?
Okay, so they are giving $2,000 to that microbiologist. They are giving those many billions of dollars to Cristiano Ronaldo. Those who play cricket should not be called heroes. Those who act in films should be called entertainers. Entrepreneurs should be called heroes.
He tweeted yesterday, "You must be watching."
So they are becoming heroes, and what are they paying the doctor for researching? How much does the Andhra Pradesh and Telangana government pay a biochemistry professor? They give 80,000 to 70,000. They give 1 lakh rupees. What research can they do? What can they not do?
What can they not do? Right, it is enough to clean the windows of the house. Hyderabad is right. Where is the education of children? They are giving bold money to those who participate in that small TV show.
So, the importance of entertainment is not there for scientists. So Mohana Vamsy said whenever you are a writer you should start an organization where you can anchor scientists. Too small for that, hopefully. These changes will happen, and also in our India more R&D is more improvement if we have capabilities to do everything possible.
That Indians have the best brains, you know it.
Correctly so.
It has to be put in proper direction.
So definitely, as you said, now instead of once we used to biopsy the tumor and test it, now we can definitely know about all cancers with just blood test. So next, coming to the treatments, I have seen my family members going through this cancer thing. Whether it is chemotherapy or radiation, is emotionally, financially, physically, the patient is dying and living. Have there been any advances that make such treatment a little easier?
I have already said that I think there will be a cure for cancer in 10 to 15 years. So especially in this surgery, robotic treatment is very useful in suturing. That is, a robot is not useful for routine surgeries, it is very useful for suturing. A robot is useful for suturing in minutes after doing a radical prosthesis. A robot is very useful for suturing when you do that heart valve replacement, except that the robot is not very useful in oncology surgery or other surgeries. Many types of new treatment options have become available in this radiation therapy. Again, because of artificial intelligence, for example, we are giving radiation in India, cervical cancer. So we did radiation planning today. One patient got it done. 4 days later, the patient got constipation. That means that the radiation suite did not pass the motion that day. So the radiation suite came to the suite. The motion was not passed. Then what happens? What does the blood-loaded blood do? It pushes the cervix in front of it a little. It does it in it.
Does it correctly?
But where the radiation treatment is done, the old doctor does it where he planned it. What happens then? A little radiation dose is taken on the blood, the dose on the part of the cervical cancer on the anus is reduced. Correctly.
It gets uncovered.
So what does this machine do? It has its own technology to see that. It sees. When it sees, it thinks. How is that? The day we planned, the rectum was well back, the cervix is here, and now the blood has come forward a little, it thinks that it has pushed the cervix a little forward. It has artificial intelligence that is
Called artificial intelligence, right things then it adapts to.
this present circumstances, then it plans radiation to this new area.
Right.
And then it delivers all. In a few minutes, 4 to 5 minutes, the treatment is done. It takes 3 days to see the same radiation oncologist and he has to replan. Oh. So the planning that takes 48 to 72 hours is done in 3 minutes.
That too accurately.
Accurate that is.
Artificial intelligence so that we can reduce the radiation-related side effects. Right, that's the best part. Right.
One day the girl came to take a radiation U-turn that day she was going to the washroom. The
Technician called me and said, "Come on, madam, this turn has come. You can
go to the washroom after that. If you miss this turn again, he will make you wait for another half an hour." Quote, she thought it was me and went inside, and the bladder is full, it pushes the cervix back a little. The treatment changes again. So this machine sees it from time to time. It says, the bladder is full, the position has changed a little, it adapts to that changed position and gives radiation.
That is artificial intelligence.
Right? This is going to revolutionize
Cancer treatment. Very less side effects. Precise dose delivery, never heard before. We are able to give treatment in a way that has never been heard before.
Apart from this, we have a brain cancer, a
4 centimeters tumor. We are planning to give radiation. After 5 days of radiation, the tumor has shrunk by 3.5 centimeters. This machine sees that what we planned was 4 minutes ago, now it is 3.54 centimeters, now it is 3.5 centimeters, so it adapts the treatment to it.
Right it.
plans for it delivers it reduces the radiation dose on the normal brain next to it.
Correct, this is
Artificial intelligence, it can't be done by human brain. It is only done by this machine. And this is ultra fast. Normally radiation takes 10 minutes, 20 minutes. It also does the treatment delivery to give it. It does in 2 minutes.
okay. It does in 2 minutes, ultra fast. So this is the future of oncology. So this is the first time in India we have brought it to Hyderabad in Chivali Omega. So right now the hospital is
Operational.
okay.
It is operational. We have already treated more than 200 patients.
Wow, wonderful.
On artificial intelligence.
So artificial intelligence is result oriented and depends on accuracy. It reduces side effects on normal organs. So how wonderful are the results you have seen? It takes time for us to, but this is time-tested technology. We are not trying out something new.
This is FD-approved technology. Indian Arb Atomic Energy Regulatory Board approved technology this is. So it has already been time-tested in Europe and the US. There are more than 30 installations. We have already brought it for the first time in India. Okay.
I said it is prohibitively expensive. $4 million.
Right.
On top of it, 30.5% customs duties on that. And the patient has to pay for it. And an annual maintenance contract of 2 crores.
Okay.
So, apart from this, there are many other types, and in the new year, we have brought it first.
Cyberknife, okay. CyberKnife is a miniature linear accelerator.
Which is
Mounted on a robot to simulate human beings, but pre-branded robots do not make mistakes.
no.
One makes mistakes.
Yes, no one makes mistakes, no.
One makes mistakes, so this robot technology gives a very precise dose. For example, a small pituitary tumor between the two eyes needs to be given radiation. It
Gives no radiation to the normal brain next to it. It is
like a cruise missile that is targeting a terrorist hideout somewhere in a small Osama bin Laden house at a range of 5,000 kilometers.
Yes, the
Missile is targeting from 5,000 kilometers away. It is called a cruise missile, a Tomahawk cruise missile. Okay. Then once it was given to Kuwait, then it was America that sent the same cruise missiles to Israel. That technology is used to target cancer cells here. So it targets the tumor precisely. So normally radiation is given for 25 to 30 days. Here, the radiation is completed in just a matter of a few minutes. For example, suppose there is a small tumor in the brain. The entire radiation is completed in 10 to 20 minutes, that's all. One day, a patient came from Bombay a few years back from an angioma treatment. An 82-year-old rich jeweler businessman came for the morning flight. The planning was done in the forenoon session. He took the treatment in the afternoon session and walked to the evening flight.
oh, that's so fast.
In those days, it wasn't even in Bombay then, it was in our Hyderabad, then it
was in OK Omega Banjara Hills. We also gave treatment to many members of parliament. They took a morning flight at 8:30 to Delhi. The treatment was very, very effective. It could be a small brain tumor, a small paraganglioma, a small arteriovena, a small formation in the brain, a small retropancreatic node, a small prostate tumor, or a small pancreatic tumor, or a recurrent tumor. All of these are treated very effectively in a very short time. CyberKnife is a technology that gives radiation very effectively.
Okay.
CyberKnife. CyberKnife is what a Telugu journalist described very well. It's a knife like a knife, but not a knife.
It's
not a knife, it's not a knife, it's a radiation device. Correct. It's a pencil beam that cuts like a radiation but a knife.
Correct. Very well said.
A Telugu journalist discussed this while writing an article.
Wonderful. So there are other technologies that are not available anywhere else, such as using radioactive isotopes.
For cancer treatment, for example, we give iodine treatment for thyroid cancer. It's a radioactive iodine treatment.
Newer molecules are coming, now. Actinium, and then many different molecules are coming. Through those molecules, we can target especially advanced cancer.
Okay.
The ranostics, and this is also called beta radiation.
We are developing the ranostics separately. We are developing the ranostics as well as oncogenomics, which is what we have discussed so far.
Genes, genetic testing. We have all of that under one roof here.
Okay. So if you ever want to come for cancer treatments, if not easily and quickly, it can be said to be a bit costly, if not very costly. Let's be honest.
Cancer treatment is prohibitively expensive, beyond the reach of a rich man. These molecules are new molecules in chemotherapy, immunotherapy. You hear about it in the daily papers. Patients come and ask, we don't want chemotherapy, doctor, give us immunotherapy, we don't need it, take chemotherapy, that is, no, I want only immunotherapy. We say, okay, that is not necessary, that is good for us, okay, sir, if it costs
Locks in 3 weeks, then medicines are expensive. They are all important molecules, okay? In spite of subsidies by the companies, they are expensive. Immunotherapies, targeted therapies, all these are prohibitively expensive, so it will be more difficult, right? In our India, the middle class is a little higher percentage than the rich, the poor.
So let's be honest, there are many more. And
earlier, if you get cancer, there is no treatment, oh, bad luck. Those who used to suffer from it are not like that now. There is treatment, but it is still painful that we cannot make an effort.
that is very unfair.
Very unfair, and very painful. It is painful for the
Patient, for the attendants, and for the patient too. Oh, I cannot make an effort. I cannot survive my closest one. I am saying that I am prolonging life, and the pain is even more terrible. If there is no treatment, there is no big pain. Alas, A disease without treatment has come. God is not merciful. A worry reconciles to the fact that it is not like that now.
There is a treatment that can be extended, but we can't make an effort. That is still painful. So, the day when we can make our own molecules, we can overcome this.
How confident are you that AI will bring revolution, just like how revolution comes here in our India? We want all the scientists to work there and go somewhere and do the work that they do here. So, if I want to ask you a quick 10-minute general doubt, I would like to ask you because if doctors like you, who have perfect doctors, experience, say it, it will create a little awareness. So you and I have discussed this before. We thought that even people who do not have bad habits can get cancer. So many people, especially those who smoke, especially those who use nicotine or weed, are afraid that I will get cancer. So how exactly does nicotine substance use get cancer? It is not actually nicotine.
Nicotine is addictive.
Now, cigarette smoke contains nicotine along with tobacco. Oh,
Nicotine is addictive.
Okay,
nicotine itself does not cause cancer. Okay, nicotine gets
Absorbed within a few seconds and gets into the brain. And gives that stimulus. I have never smoked, but smokers say.
It has.
Whatever effect I don't know, but it causes a kick. Oh. So nicotine is addictive, okay, but nicotine is not the toxin. That tobacco within a few seconds of smoking, about 70 to 80 carcinogens are inhaled by us. They get inhaled and go into the blood. They go into the blood and cause cancer throughout the body. Tobacco affects every organ in the body. From the blood vessels in the brain, can you believe it? Cervical cancer is not seen in the Western world, because the human papillomavirus is less prevalent there. Only coastal Andhra Pradesh, Tamil Nadu. If not in this cancer, we see the eastern coast of Somalia, Mozambique. Why are these cancers?
doctor.
Because the human papillomavirus spreads in the humid environment there. But in the Western world, women who smoke get cervical cancer. Imagine, if they smoke near the cervix, it gets secreted near the cervix and causes cancer there. This cigarette smoke is so dangerous. They eat gutka. I chew gutka. I think, why do I have cancer? I don't ingest it, he says. In 6 seconds, it is absorbed into the blood and causes cancer not only in the mouth but also in other parts. Right, the dangerous substances in cigarette smoke and tobacco are all.
due to these. Half of the cancers are due to them. If you had called a parliament meeting today and banned tobacco in India because of tobacco, 45% of the cancers in South Indian men would have been wiped out.
Wow, we want such changes to come. But you have already said one thing. Cancer cells take glucose for the energy they need. So, is there
Any glucose in the test?
question mark? So, is that a theory? Now you have to tell me whether it is correct or not. We have high glucose in sugar. So for those who are looking for cancer prevention or for those who have cancer, it is compulsory to prevent any glucose from going outside, like stopping sugar, stopping sweets, honey, all of it. By controlling it, we can control it.
This is a popular misconception.
This is just a misconception. It is not a cancer cell. Whatever you eat in our body, it reaches that cell in the form of glucose. That is a body manufacturing process. It is our fat. Only if we eat fat, that fat gets converted into glucose and goes into the cell and cell activities take place. Cellular activity. So glucose should not be consumed. Many patients ask me like this. When you ask me, sir, we say, sir, you should not eat sugar. They say, can we stop eating sugar? Anything in moderation is good. Sugar means white. Why do I personally believe that white sugar? All white things are dangerous. White sugar. White salt, white flour.
White rice, okay. Polished rice, right.
All these are dangerous.
In the past, we used to eat rice well.
In which all the vitamins came in equal quantities. Instead of this white sugar, I mean native sugar, brown sugar, etc., And if you eat more, it is important for everyone, for you and for me. Yes, instead of white rice, it is flour. It has to be content. It has to be content. It has many calories, so instead of it, we can say wheat, barley or some other whole grains. By taking these, we will get better benefits. So nothing is carcinogenic, that is, if I take white sugar, I will get cancer. A famous celebrity.
Ask me that. That wife complained to me. That celebrity's wife got cancer. Then Dr. Nori came to America and treated him.
He asked okay. He gave me a B complex tablet. It is very popular in America.
Okay.
Everyone uses that tablet. She complained that the cancer increased due to taking that B complex. She complained to me that it is just multivitamin. Multivitamin will make cancer cells grow more. So this is again a popular misconception. So eating sugar increases cancer. People with cancer should not eat sugar. Nothing like that. Who should eat sugar? It should be taken in a low amount. It should be taken in a proper amount. The carbohydrates that our body needs, fats, and fat are also essential. Likewise, proteins should be taken in a proper ratio. It is not more or less.
Okay, so third one, this is coming from Western side now, and our India also theory is that I have seen in many YouTube videos. Fasting cancer fast for 48 hours, 72 hours, water fasting, food fasting, so many things like that. So really by doing fasting like this, there are chances of losing anything but not.
Losing anything fasting has no benefit except loss. It is very important for us to take food at the right time of the day.
Very essential, especially cancer patients. They really have no taste, they have no appetite, they are taking chemotherapy, they have depression, that they have cancer first, they don't really have the sense of eating what they are doing fasting. If there is no nutrition, how will they tolerate the treatment? It's absolute trash, so they should take good nutritious food. Okay. Good neutral fruits, vegetables, all good proteins, skinless chicken, egg white, milk, best proteins. And all should be taken in the same way, except that fasting kills cancer cells, which reduces cancer. That's not correct.
Okay, so what are the last two questions? 1. Now breast cancer has increased a lot among our Indian women, and also ovarian cancer. Those who suffer from PCOD, PCOS, etc., think that they are prone to these cancers.
The incidence of breast cancer is slowly increasing, but not so much. Cancer through the cervix
is more common, and we have 1 lakh new breast cancer patients diagnosed every year, while 2.5 lakh cervical cancers are being diagnosed. So that's breast cancer increasing. The reason why breast cancer is increasing is
because of the lifestyle and nutrition of those in our urban areas, which leads to early menarche.
They get menarche early. Then they get married late. They concentrate on their education and career, and after getting married, they again concentrate on their career to plan a family and have a baby.
So, 30 years pass. If a woman has her first child late, her chances of getting breast cancer are very high. Suppose a woman has her first child at 18 years old. In our rural India, 12% of women get menarche, 15% get married. If a woman has her first child at 18, her chances of getting breast cancer are very low. There are a lot of hypotheses for it, but it is true. The absolute truth is that even if a woman has her first child after 30 years, she has no children. When compared to a woman who had her first child at 18 years, the risk increases 5 times. If a woman has her first child late, her chances of getting breast cancer are very high. All these things are also true. If you work night hours in these BPOs, your chances of getting breast cancer are very high. Then the last and most important thing I wanted to tell you, which is my personal observation.
Okay, is that for
cancer to come back? Our immunity should be good.
Right, our immunity should be good to prevent it from coming back.
Now, when Corona came, we saw that many of us had Corona. The milkman who came to our house gave it to us. Our servant gave it to us. Our gardener gave it to us. Our maid gave it to us. They were all fine, but they are gone.
Yes.
What is the reason? The immunity that was in them is not in them. Okay, he only cares about that day, whether he got work that day, whether he got food that day, whether he slept, but they think more about the next day. So, mental anxiety is the last
part I wanted to discuss. Good that you asked. Above.
What you all need to know, what all our viewers need to know is that the most harmful thing is mental anxiety. More harmful than tobacco, more harmful than diabetes, mental anxiety. If there is mental anxiety, their immunity decreases. The best immune booster is happiness, okay? Happiness, right, and good sleep. The best immune boosters are those who are well fed and happy all day long. They will not get corona or cancer. It will also reduce the risk for those who have cancer. My own personal observation is very interesting and very important.
So,
She is a 72-year-old lady who has been coming to me for checkups for 8 years. She is 74 years old, 8 years old. They come to me together. He wears a suit and comes to me every day for checkups. Even in midsummer, suddenly. One day he did not come. I said, "Oh, Gopal Rao did not come. Gopal Rao did not come." Quote, I changed his name. Suddenly, that girl fell on my shoulder and made me cry. She was a 72-year-old lady. The other day, he had a heart attack and died. It's been 2 months since he died. I
Did the tests and he's fine. He's gone.
Exactly 4 months later, he came back with cancer. He hadn't had cancer in 8 years.
So he was worried about his husband. He did another patient surgery. It's been 5 years since he had breast cancer. We thought it was advanced cancer. It's been 5 years. It's fine. They married the girl early with advanced breast cancer. Exactly 5 years later, after the same marriage, they divorced every 2 months for 2 to 3 years.
Cancer opened up for her.
I wrote a full-page article like this about Kutharu divorce. Once in Andhra Jyoti, my experiences were written like this. That day, my sister called me a long time ago and called me home.
and
Told me what was that day. This is very correct. Vamsy. He said that I will also go when I have a heart attack. I chose the number 20 on my car. I said that I will live till then. After that, I played, sang, acted. My ejection fraction was 34. What can you not do? He lived 90 years with mental courage. He was right. When did he get it? He had a heart attack before N.T. Rama Rao. Oh my God, that.
Corner bypass. He went to Houston in those days. So, he said that mental courage should always be brave. So, the most important immune modulator for all of our viewers is this. Be happy. Happiness is half the strength. Elders and ancestors said.
Don't fight nature after right. That means when air-conditioned rooms, synthetic clothes, get exposed to sunlight every day, not vitamin D, we don't know how many other vitamins there are. It could be vitamin Z, it could be N, it could be M, it could be O, it could be anything. Scientists don't know how many vitamins there are.
In sunlight. Get exposed to sunlight. Eat organic foods. These pizzas, these high-calorie pizzas, burgers, they are all refined foods, refined oils, reused oils, the chili, the budgie, the same oil is used from morning
to evening. That is the most important risk factor for cancer. Reused oils, microwave ovens, these are called those plates. Look, Teflon-coated pans, all that. We are fighting with nature. If you wash them in the morning, you will get a plastic toothbrush, a synthetic toothpaste, a plastic tank cleaner, a plastic mug, a plastic bucket of hot water, and then it would be good if we spread synthetic clothes and tie them to our weather. We can't wear cotton clothes at work, but those synthetic suits and air-conditioned rooms. You don't want to smoke cigarettes. If you wait for 5 minutes at Panjagutta intersection, you will get the pollution of 100 cigarettes. So, exercise regularly, maintain lean body mass, eat more fresh fruits, greens, vegetables, and eat less meat and red meat. Exercise regularly, maintain lean body mass, and if you don't meditate happily, if you spend your time peacefully and happily, you will not get cancer or any other disease. Sir has actually given a lot of information and also informed all those who are in the cancer battle that even though the treatment is very expensive, there are advancements with less physical stress and mental stress. Also, everyone who thinks they are prone to cancer can easily find out if they have cancer through a small blood test and at what stage it is. He explained to us very well today about all the advancements that can detect it. We are really glad and thank you so much for the time you have given, sir.
And for more videos,
Please subscribe to iDream. Please subscribe to iDream. Please subscribe to iDream. And please subscribe to iDream. For more videos, subscribe to iDream.
Please like, share, and subscribe to the channel.
congratulations iDream, subscribe to iDream.
Subscribe to iDream.
So subscribe to iDream Media, iDream to iDream. Huge congratulations to all the iDream team. Please subscribe to iDream Media. Please subscribe to iDream. Subscribe to iDream. Please subscribe to iDream.
iDream means subscribe to my dream channel. If you are, hit the bell icon. For more such videos, please subscribe to iDream. Subscribe
To iDream, please subscribe to iDream. Please subscribe to iDream Media. Please do subscribe to iDream. Please subscribe to iDream Media. For best entertainment and information, please subscribe to iDream. And don't forget to subscribe to iDream.